Hello everybody, this is Dr. Persley with PC Wellness Centers, and I'm here today with Daniel Ellinghouse.
Hi.
Yeah. We're going to have what we call healthy conversations today. We're just going to talk a little bit about chiropractic, how it's helped him in his life, and what he thought maybe before he tried chiropractic, and basically the before, the middle, and the after. So, Dan, appreciate it, man. I appreciate you
no problem.
doing this.
Glad to be here.
Yeah, absolutely. Tell us a little bit about you and where you work, what you do, and all that good stuff.
Oh, I work in retail. Been in retail probably about 15, 16 years. Traveled a little bit with retail. Cape Girardeau town person. Moved away a couple different times, but Cape Girardeau always brings me back. Had some mobility issues arise this year and didn't know what to do. So researched some things. Called Dr. Persley. My neck had locked up, and I actually couldn't even barely get my shirt on. And he said, "Yeah, I can get you in. I can see I can fix you." And just like that same day I had mobility back in my neck, was able to go to work, and I keep coming back to him because you can see a difference in a progression. You think you're okay until you feel pain, and then you start seeing Dr. Persley and you see different improvements and different mobilities. And when you first start out, there's all this hesitation. Hey, can you do this? Can you bend this way? I was like, no, I'd rather not. We're okay. And my expectation was like, oh, I'll have to keep going all the time. It'll be a weekly thing. There'll be this thing that he recommends. There'll be this thing he tries to sell me. In all reality, he's very honest. He makes it simple for me to understand. And that's one of the big things is, you talk to some people in a medical field, it might be complicated for you to understand. For me, having the way he speaks to me and generally cares about me is part of the reason I keep coming back as well.
Yeah. And when you say keep coming back, I mean, our goal is to get people, what we say a lot is adults, we recommend that they get checked out about once every month to 3 months as a preventative approach, preventative method, and kids get checked out every about 3 to 6 months as a preventative approach. Even if you're not in pain, just getting checked out, it kind of gives us an opportunity to see if something is not working properly. It's called function, right? So, if it's not functioning properly, it will lead to pain or problems. So we want to make sure that everything is functioning the best it can to prevent the future likelihood of problems. So that's when you're talking about.
Right.
And that was our goal from the beginning. It's let's get rid of these symptoms.
Right.
And then improve function, and then more of a preventative approach.
And, the different exercises at home to, keep you going through the day, because, you explained it best. If you don't continue to push yourself past what your mental problem is more than your physical problem, it's just hard for me to explain. It was more mental in certain areas than it was physical. And once you pushed yourself past that boundary, it was life-changing. I mean, the mobility I have in my neck and in my lower back is vastly different than what it was. And parts of things I didn't know were mobility problems, we discovered were. And the best part is my posture's increased. I don't have a hunch anymore. I had a slight hunch, and of course it was from looking at my phone, just losing time. And what'd you say it was? You recommend what?
Yeah, if you're gonna play on your phone or do something with your phone, hold it out in front of you and in a proper posture. And when your arms get tired, then you shouldn't be looking at your phone anymore anyway, because your eyes will get tired too. But if your arms get tired, then you should stop.
I practice that more than anything. That little nugget of help was really beneficial as well.
Yeah. I always explain it like this. Every day that you're alive, there's a box that's kind of closing in on you. And if you don't constantly push against that box, which is, flexibility or weight training or activity or whatever, but if you don't constantly push against that box, it will cave in on you eventually, and you aren't able to actually get that, then you're stiff and tight. And, that's the way I generally see people is they have become tight over the years, and then they get stiff and injure themselves because, think about it, the stiffer you are and the less flexible you are and the less muscle tone you have, the more likely it is you get an injury.
It's very true. I mean, and you even said it best, people will make 5 million excuses. Once we're honest with ourselves and quit making excuses and are honest with you of, hey, am I doing this? Am I not doing this? Because in reality, if you don't see any improvement and you're still investing in doing what you're doing, but we're still not doing what you ask us to do, right, we're not going to see results that we want to see.
Yeah, and that's why I do this a lot with the mental side. Like, hey, I can't care about your health more than you care about your health, right? And so we talk about that sort of stuff. Anything to add? What if somebody's watching this and they're on the fence of whether they should go, should I call a chiropractor, shouldn't I? I mean, what would you say to somebody like that?
I would say if you're on the fence, why not take a chance? It's a whole lot easier to say, hey, I didn't get out of that what I wanted to get out of versus, I wonder if I would have done this, what the outcome would have been. And I mean, it's you do a little bit more than just the chiropractic side. I mean, you generally ask, how is your day? It's not, how is your mobility? What is you having today? It's, what's going on? How was your weekend? Like you asked, how was my vacation trip? And, you know, you give a little bit of your personal life. You mentioned how you enjoyed the weekend with your family and watching the Blues game, you know? I think that's really enjoyable too, because it's more than just a business relationship. Mm-hmm. You get more invested in the relationship portion. For me anyway, was beneficial as well, because it felt like I wasn't just a client. I was more of like, hey, let me make sure I genuinely care about you, not just your chiropractic needs.
That actually came from when I was first starting into practice. I used to observe a lot of other docs, and I hated the numbers game. That, you know, it felt like patients were numbers, you know, and I hated that. I was like, no, I want patients to be like family. I want them to be, you know, excited to come in and chat and that sort of thing, and make sure that we know about not just, you know, your physical issues, but we want to know about your whole lot, you know, how you're doing in life in general. Because, you know, it's a lot easier to get better if everything else is going well, right?
Oh, I mean, yeah. I mean, you can be fine mentally, but physically, if you're not well too, it's going to cause mental issues as well. You're like, oh, you start getting bitter because you're hurt for the day, and then it causes other mishaps throughout the day as well and week. So
and you start to have fear. I'm afraid it's going to hurt if I work out. Then you don't work out, and then you get depressed, and then you eat, and
it's just kind of a downward spiral.
Yeah, that's
I mean,
exactly right. And there's a lot of people that can relate to that.
Oh my gosh, I tell you, if you're going to invest in something, invest in your, you know, and I talked about this before you came here, you know, invest in your physical health, your overall, what you put in is what you're going to get out. Yep. And then the thing that you express the most is you have to be willing to push yourself rather than just hoping someone's going to fix it for you or give you some magic pill.
Or the idea of, oh, it'll go away.
Oh,
if you don't change your habits, it ain't going to go away. It's just going to get worse. I mean, reality, right? Reality check. And that's what I like to do. I like to have reality and make it as simple as possible. I mean, the easier it is, the better.
It's true, and you profess all the time about how everyone's got the same 24 hours within a day. It's what you choose to do with it. I mean, even watching you as I come through here, I see how you started investing in yourself. I mean, it's not that I just watch everything that you do. It's great that you're not one of those doctors that say, do as I say, not as I do.
Right.
You're trying to take care of yourself and then learn from your own experiences and invest into your patients what you've already learned on your own.
Yeah.
And I think it's great. Like I said, I can't get over the changes in me and just the overall experience when you come in. The scheduling's flexible. You know, you don't feel like you're chastised if you have to rearrange your appointment. And the day that you got me in, when I had to lay on the floor, I remember just my neck like this, laying on the floor, looking and trying to get a hold of somebody. And I was like, well, I'm going to give this place a call. I like the reviews. They're close to the house. Explained what was going on. I'm pretty sure I talked to you, as a matter of fact.
I think I answered the phone, yeah.
And that's the other unique thing, too. You're not always going to get who's working at... Laura's a great person, but you're not always going to get her, and that's the cool thing, too.
Yeah.
There's not that, well, I have to talk to this person first before I can talk to the doctor. I mean, I just remember laying on the floor, like I said, just never felt immobility like that. And I come in, and bam, I have mobility back in my neck the same day.
Yep.
Now, granted, we had to start out like once a week, and then it went to every 2 weeks, and then now I'm every 3 weeks, if that. And it's just a little minor tweak here or there.
Yep.
Because like this visit, it was because I took an 8-hour road trip one way to go visit my friend in Wichita. I come in feeling like a 2 to 3 level, and then now I'm leaving today with complete mobility in the neck and in the back. I don't feel stiff at all. Yeah. And then you're just happy for the rest of the day.
And I remember too, you were concerned about your low back. I remember you were more, obviously when you first came in, your neck was hurting, but you were like, oh, my low back's just gonna be terrible the rest of my life. And I was like, well, let's check on it. Let's see. Did a few tests. Oh man, we can help that. Treated you, and holy cow, now I can do squats, right? I mean, that's kind of cool. So, all right. Well, hey, thanks, Dan. I appreciate it. And if you have any questions or have any insight, please comment on here, or you can email me at drpersley@pcwellnesscenters.com. Share it. I appreciate it if you share this. Somebody might get some benefit out of it. The whole goal is to educate the community so people will improve their own health. And they can take their own actions to do that. But I recommend prevention. We talk about 3 things. Number 1, prevent things on your own.
Right.
And that's through muscle tone, flexibility, and nutrition. And then number 2, come and see us about once every month to 3 months if you're an adult, or if a kid, every 3 to 6 months as a preventative approach. And then if you happen to have an injury or accident, then, okay, come in and we'll get you fixed back, but then put you back on that number 1 and 2 in order to prevent 3. And here's why. Number 3 is more costly. It's time consuming. You're in pain. There's a lot of problems with that. So we want you more on the 1 and 2 side as opposed to the 3. Other than that, I appreciate it, Dan. Everybody have a great day, and please share. All right.
Make sure you give him a call.